Hi, I'm Dr. Don Bonner, and I'd like to welcome you to my functional medicine clinic, Personalized Wellness. What exactly is functional medicine? That's the first question I get from everybody. Well, functional medicine is a systems-based approach to medicine. What we do is we look at the body as having multiple systems that are all interrelated, and that by getting a very accurate history from the patient and lab work, we're able to pull all that information together and start searching for the root cause of any particular problem. And oftentimes these systems are all interrelated. So finding that root cause may be in a completely different, unrelated, seemingly unrelated system that is the cause of whatever symptom you present with. Again, that seems confusing, but let me give you an example. Again, say you present with gastroesophageal reflux disease, and you've been placed on a proton pump inhibitor to decrease the acidity in your stomach. Well, the first thing we would do, we would ask, why all of a sudden do you have increased acidity causing reflux? You didn't have it a month ago, 2 months ago. Why all of a sudden do you have it now? And what we would do is, again, we'd get a history, get a lot of lab work, and try to figure out what the root cause of that reflux is. And if you can establish what the root cause is, you can treat that root cause and then get rid of the presenting problem. So in this instance, say we establish that the root cause was small intestinal bacterial overgrowth. We will treat that small intestinal bacterial overgrowth, get it cleared up, and all of a sudden you don't have reflux anymore. But that's what we do. I would say the top things that we treat and that we see most often are, number one, resistant weight loss. People have difficulty losing weight as they get older. Number two, fatigue is very, very common. Number three, hormone issues. Sex hormones, be it men or women, thyroid hormone, adrenal hormones, and then difficulty with blood sugar regulation and insulin, difficulty with insulin and insulin resistant, very, very common. The next thing that we see are gastrointestinal problems, like we talked about before, very, very common. Gastroesophageal reflux disease, H. pylori. I see a lot of parasites, small intestinal bacterial overgrowth, irritable bowel syndrome, functional GI problems such as diarrhea and constipation. And finally, we see mood disorders very commonly, depression and anxiety. If any of those things, ring true to you and you're having problems with any of those issues, give us a call here at the clinic. I offer a free 15-minute phone interview to all patients. You can get to know me a little bit. We can talk about what kind of problems you have and whether I think that we can help you or not. And we can go from there. So give us a call. I look forward to hearing from you. And I thank you for checking out my website and Personalized Wellness. Thank you.